Hello and welcome to our presentation, Information for College Staff, Tips on how to support a student with Prader-Willi syndrome in your college. Prader-Willi syndrome, or PWS, is a really rare, complex condition that at times can seem really overwhelming. But when the environment is right, the student with PWS can really thrive and will be a pleasure to have around. So I'm going to talk a little bit about the genetic side of Prader-Willi syndrome. As I've said, it is a rare genetic syndrome. You can see from the pictures on the right hand side, at the top is what our chromosome 15 would normally look like. When it comes to PWS, there are two main subtypes. The second picture down shows that there is a complete chromosome 15 from mum, but you can see that there is a missing piece on the chromosome 15 that comes over from dad. This is called a deletion and accounts for about 75% of cases. The bottom picture shows a maternal disomy, which accounts for about 20 to 25% of cases. This is where they receive two chromosome 15s from mum and no chromosome 15 from dad. Neither of these forms are inherited, and in addition to this, there are about 5% of people with PWS that have a form called imprinting or translocation. This can be an inherited form of the syndrome and may mean that you will go on to have more children with Prader-Willi syndrome. During this presentation, I am going to be talking about the more problematic aspects of Prader-Willi syndrome, so I think it's really important to start with the positives. This list isn't exhaustive by any means, but as you can see, they have some really lovely positive attributes. It's really important to have an understanding of PWS, but equally as important to have an understanding of your student, their strengths and the activities that they enjoy. Prader-Willi syndrome has distinctive characteristics. We're going to have a brief look at them now, but we will go into more detail as the presentation goes on. Hypotonia is low muscle tone, and although this is more evident at birth, it does remain with them throughout their lives. However, growth hormone treatment does have an impact on this. Hyperphagia is an excessive, overwhelming appetite. This usually appears around the ages of 2 to 4, but it can be much later for some children. There is often a learning disability, but not always, and this can range from mild to moderate to severe. When we speak about a learning disability, we mean in a medical sense. There is immature social and emotional development. There is a set of behaviours known as a behavioural phenotype that goes along with Prader-Willi syndrome. Hypogonadism is an immature sexual development that will affect girls and boys differently. And there's also a sticky or viscous saliva. Now this can present itself in gathering of spit at the corner of the mouths. You may notice that there are times during the day when their lips appear very dry, and it may also have an impact on the way that they form their speech. It's not uncommon for those with PWS to have a dual diagnosis. It's important to find out whether this affects your student and how best to manage it. I'm going to go into more detail now about the characteristics of Prader-Willi syndrome, beginning with hypotonia. Low muscle tone will mean that a student with PWS is likely to have greater difficulty moving around the classroom and the college, and a risk assessment is usually required. They may be more unsteady when standing or walking, slower to move around the college, and less able to walk long distances. You'll need to take this into account and allow extra time for your student with PWS to get to other classrooms. Look at whether help will be needed carrying bags and how they're able to cope with steps and stairs. If a wheelchair is required, how accessible are your outside areas? Most students with PWS will require differentiation and very clear, simple instructions. Now, physical activity is incredibly important for those with PWS to maintain a healthy weight, build muscle tone, and form the habits that will keep them healthy later in life. Every effort should be made to engage the student with physical activity, even though they may find this difficult. You'll need to be aware of additional trip or fall hazards within the classroom and around the college, in particular jostling from other students and bumping into each other. Safety within outside areas needs to address the likelihood of being knocked over or bumped into without affecting their ability to socialise and join in with peers. Low muscle tone will also affect speech, language and communication. There can be a range of speech and language difficulties affecting both expressive and receptive speech. This means that some individuals will have a greater level of understanding than their speech would indicate. However, others may be quite articulate, but their comprehension levels are low, so be sure to check that information has been processed and understood. Various speech and language problems have been diagnosed in those with PWS. A speech and language therapist may still be working with the student, and this can be checked in the EHC plan. Sessions that focus on feelings and emotional language can make a huge difference. Visual prompts can sometimes be helpful in easing frustration and aiding communication. Hyperphagia is one of the characteristics that makes Prader-Willi syndrome so unique. The excessive appetite in the individuals with PWS can be a relentless, overwhelming hunger, and your student will display this. In some individuals it appears much later or to a lesser degree, so it's important to carry out a best interests review or mental capacity assessment. Ideally, this should be held before the student starts college. It's imperative to establish good communications with all those involved to ensure that measures are put in place when and if the student displays the desire to eat. Additionally, individuals with PWS have no feeling of being full, so the appetite is never relieved, and they'll not instinctively know when to stop eating. Unmonitored, they could continue to eat and food binge, leading to morbid obesity. Those with PWS also require far less calories than others and must follow a very healthy, low-calorie diet, which will be guided by their dietitian or other medical consultant. Your student's weight will be monitored closely and the diet adjusted as required. Weight can be gained very quickly and easily. It's essential that the student's dietary guidelines are followed precisely and that everyone working with them respects and applies the measures in place. Although colleges promote independence, there's to be no deviation from this, and absolutely no food should be offered to your student with PWS without prior agreement, even if your student claims to have missed breakfast. One weak link can undo everything that everyone else is trying to do and will send mixed messages to the student, which can be very confusing to them. Hyperphagia means that your student may food seek, food steal, and they're likely to become very anxious and agitated if they're thinking about or fixating on food. It's really important to control the environment around them to enable them to thrive. All food must be kept out of sight as much as possible, and it's advisable not to keep snacks in your handbag, briefcase or desk drawer. Never allow your student with PWS to be unsupervised around food. If you reduce the temptation, you reduce the levels of anxiety, enabling them to focus more on learning. They'll need to be accompanied when walking to other parts of the college, particularly when changing lessons, to reduce opportunities to access additional food. If food is provided, be mindful of how easy it may be for them to take food from someone else's plate. They'll need one-to-one supervision during lunchtime to avoid this, and food plates, once finished with, should be cleared away promptly. You'll also need to review access to food bins and any food outlets, including those within the vicinity of the college. When teaching food technology, ensure that healthy options are used and encourage your student to make healthy choices. There's no reason for them not to take part as long as they're supervised, and it's always best to send the student home with what they've made. This enables parents or those responsible for their care to work out calorie content and have a very clear picture of what's being consumed. What happens on trips? You'll need to ensure that if there are refreshments, that these can fit with your student's usual diet. Once again, it is essential to liaise with parents or those responsible for their care about the regime they'd like you to put in place in these circumstances. Often, with pre-planning, it may be possible to give extra treats if your student's aware that they may have a little less to eat when they get home. Some individuals with PWS have been known to eat non-edible items, and it's important to be aware of this. It's advisable for students with PWS not to carry cash. This will reduce the temptation to use vending machines and such, although there is always the possibility that another student will buy it for them. It's not unusual for students with PWS to be escorted by support staff when in the canteen, and staff should be aware of what they are and are not allowed. If the student has canteen meals rather than prepared food from home, it's always really helpful to provide a picture of portion size and to keep those responsible for their care informed of all the food that's being eaten. Always remember, even if your student doesn't actively seek food, it doesn't mean they won't if given the opportunity. It's always advisable to put these measures in place even if your student is not yet showing food-seeking behaviours. There's a wide range of ability in PWS. Although the majority of individuals with the syndrome have mild to moderate learning disabilities, a significant minority have cognitive abilities approaching average and beyond. At the other end of the spectrum, some may have severe learning disabilities. Many have relatively good reading skills by the time they reach the end of their schooling, but may still struggle with mathematics. Those with PWS benefit hugely from visual reminders and prompts about activities. Processing information may be a little slower than in others, and they may need extra time to understand what you've said, or you may need to show them. Many are very able and enjoy creative work, although some may show characteristics of autism spectrum disorder, such as wanting to do things in a certain way, repetitive behaviour, or having a lack of social skills. This may be related to immature social and emotional development rather than true autism, but if this is suspected, professional advice should be sought. I'm now going to talk a bit about the social and emotional development in PWS. Those with PWS appear more socially and emotionally developed than they are. As their peers mature, those with PWS will tend to retain childish interests and preferences and lack the maturity of others the same age. Social time is more difficult and friendships can be hard to establish and maintain, so enlisting the support of staff will be important. Consider targeted social skills groups around friendships and relationships for your student. Communicating appropriately can be difficult for those with PWS, and the usual ways of communicating with very young individuals works well. It may be necessary for this to remain in place throughout their college life. Checking that the student really has understood what you say is vital, as they'll often say they've understood, whether they have or not. Repetitive questioning, or perseveration, is often a stage which many young children go through, but those with PWS are likely to carry on doing this. Immature social and emotional development will also impact the student's ability to manage difficult situations, and their reaction may be the same as someone much younger. Those with PWS will develop slower than their peers, and this may result in your student finding it difficult to manage. This may also lead to them being more susceptible to peer pressure or bullying. Your college should already have an anti-bullying policy in place, and all staff should be aware that recognising bullying may be difficult for those with PWS. It's really important to remember that every individual with PWS will be affected to some degree by immature social and emotional development, regardless of whether or not there's a learning disability. Moving on to behaviour now, it's really important to know that not all individuals with PWS will display all of these behaviours, and it's important to understand that these behaviours are not learned. Although it rarely presents as such, behaviour is a form of communication, and those commonly displayed are emotional outbursts and rages, which may occasionally become challenging. Obsessive behaviour. Now this can be related to people. They can easily become obsessed with one particular person, but it's also related to objects or food. Manipulative behaviour, with some exhibiting storytelling and fabrication. It's important to work closely with parents to ascertain if your student displays these behaviours, and if they do, always check what the student's telling you. A rigid method of thinking, often in terms of black and white, means the child with PWS can have difficulty processing instructions or switching attention from one subject to another. Once a fact is learned, it can be really difficult for the student to unlearn it or to appreciate that it may not always apply. Skin picking is a known behaviour and can be difficult to control. It can be a result of boredom, anxiety, or just because there's a rough piece of skin or bite. The student's unlikely to feel pain from picking, and while covering the area helps, it may not stop it. Like most individuals, those with PWS work well when they can look forward to rewards for completing tasks or improving problematic behaviour. Smiley faces or star charts work really well, and being given responsibility for something works well as a reward. Do not use food as a reward under any circumstances. Almost every person with PWS presents with behaviours which can bring challenges to either themselves, those around them, or both. However, this varies considerably between individuals, and it's important to remember that these behaviours are part of the syndrome and have clear underlying causes. Feelings brought about by unrelenting hunger can be distressing and lead to behaviour changes. Many individuals and young adults also have specific emotional and learning disabilities which can impact on behaviour. These may be evident even where the student is functioning at a relatively high intellectual level, and includes difficulties in processing spoken information, as well as speech and language disorders, which can be frustrating for both the student and the listener. Those with PWS can go from happiness to anger or sadness in a very short time period, and this can be triggered by relatively trivial events, such as a change in temperature, an increase in noise levels, or a change to their diet or meal routine. Other factors include a chaotic environment, conflicts of opinion amongst those working with the student, and negative attitudes or hostility, whether hidden or obvious, on the part of the staff. Your student will be very sensitive to tones of voice and body language. Tiredness can be an issue for your student, and they may work better if a daytime nap is built into their timetable. A quiet corner works well if this is needed. It's important to remember almost all of these behavioural issues are caused by the dysfunction in the hypothalamus, not by the student themselves. Continuing with behaviour, it's sometimes possible to prevent an imminent outburst, especially if you have a good knowledge of your students' triggers or how their body language may change when it's about to occur. The attitudes of other people are also very important, and likely to have a negative effect on a student with PWS are aggressive attitudes or tones of voice, a confrontational approach, being overly sympathetic. This can be perceived as a reward. Displaying a dislike for the student or trying to talk to them too much, being in conflict with another member of staff, and this is particularly important when it comes to rules and expectations. Using negative language as a means of trying to stop the student from doing something. Likely to have a positive effect for students with PWS are a firm but caring attitude, staff's ability to keep a sense of humour. Although this can be difficult when confronted with challenging behaviour, it makes a huge difference. The ability to give clear guidelines and boundaries, and most importantly, be able to stick to them. Offering praise and stressing the positive aspects of the student. Visual charts work really well for this. And using positive language as a way of showing the student how to do something correctly. What can you do if an emotional outburst occurs? It's really important to have a plan in place for what to do on these occasions, and that all staff are aware and consistent in using it. Below are some guidelines that we recommend. Remove the student or the audience from the situation if necessary. Take action to ensure their safety and the safety of others. Stay very calm, talk softly and as little as possible. Avoid eye contact. If possible, bring someone else in to take over if you're the object of the outburst. Don't attempt to reason or argue, even if the student is undoubtedly in the wrong. This will only prolong the outburst and cause it to increase. Although this is difficult, don't give in to their demands. If you do, they can learn that outbursts will get them what they want. Try distraction and humour again, and do your best to ignore the behaviour associated with the outburst. Those with PWS can have obsessive and or compulsive behaviour, and they can become easily fixated on one member of staff. So if it's possible, use several different people to work with them at different times, but ensure your student knows you'll be doing this in advance. This strategy can work well if one of the staff are unexpectedly sick or on holiday. Try to channel your students' behaviour into learning opportunities, such as for a subject they may find particularly challenging. Support the student as much as possible to move on to the next activity by implementing strategies used for those with autism. Due to the nature of PWS, difficulty in adapting to changes in routine can be a problem. However, the following strategies may help when these situations arise. Try to preempt likely changes where possible and prepare your student in advance. This is particularly important if there are changes to the timetable or to the classroom where lessons will be held. If there's a need to move from classroom to classroom, this is going to prove challenging and confusing for your student. It's important to ensure that appropriate support is in place, and this can be provided by a member of staff or by utilising a buddy system. Time prompts may also help with the transition from room to room, such as a timer counting down to the end of the lesson. This will give the student time to prepare and think about what they need to do. Visual prompts may also be useful, particularly for navigating around the college. A simple map of the college showing clear pathways to each classroom can help ease anxiety, and the use of photographs may ease confusion. I want to talk briefly about exams and what you can do to support your student to achieve these. Many students with PWS have achieved GCSEs and beyond, and this has been achieved with appropriate support in place. It's important to consider the following as your student approaches their exams, just to ensure that they receive the support they require to meet their needs. Now, there may be a need to use differentiated assessment procedures, such as a portfolio of work. Extended exam times may be necessary to enable the student adequate time to process information. Exam instructions may need to be clearly and simply explained to the student by a member of support staff. Again, visual prompts may also be useful in helping explain instructions and time restrictions. Every effort should be made to ensure your student with PWS is given the same opportunities as those that don't have disabilities. Be aware that if your student is feeling under pressure, they may display some of the challenging behaviours. Individuals with PWS usually have incomplete sexual development, and both males and females may not enter puberty. It may be necessary during lessons to include the fact that some people start puberty very early or very late, some don't enter puberty without receiving hormone therapy, and not everyone's able to have children. It's also important to be aware that when coupled with immature emotional and social development, immature sexual development may lead to inappropriate behaviour, but with very limited understanding of why it may be inappropriate. As with any other young adult, your student may develop an interest in having a relationship and will need support around this. We're currently working on a video entitled Growing Up with PWS, and our hope is that it will be a helpful resource for individuals with PWS to understand their feelings and emotions. I'm now going to talk about what we refer to as the hidden risk features of PWS. It's vital that this information is passed to the college nurse, but that all staff within the college setting are aware of the following risks. Many individuals with PWS have a high pain threshold and won't register pain. It's therefore very important that they're checked over thoroughly if they've had a fall. And if any problems are suspected, your student must be taken to the GP or A&E. Some individuals may also suffer diarrhoea or constipation without complaining of pain. A common feature in PWS is the lack of vomiting reflex caused by the poor muscle tone, and this can mask the fact that they're seriously ill. It's important to find out from the parents if your student has a history of having vomited before, and if they vomit whilst in your care, you must inform the parents immediately. Some individuals have a base body temperature that's slightly lower than normal. It's important to know what your student's usual body temperature is and have a record of this. If it's usually lower than normal, a rise in temperature to slightly above average is equivalent to a high temperature in another person. Your student may also have difficulties in distinguishing if they're too hot or too cold. Easy bruising is another common feature of PWS. Due to the high pain threshold, your student may not be able to say how the bruise happened, and this is another reason to keep a record of any falls or bumps. As all of those with PWS are different, check with parents about these risk features, and you can find a list of these and other risk factors on the PWSA UK website. Every individual with PWS will have variable abilities, and it's important to gain as much information as possible from the parents of your student before they attend your college. These include: does your student have any difficulties with fine motor skills? Are they able to grasp writing equipment? Information about diet and the dietary regime, including exactly what your student is allowed for snacks and lunch. The more information you have about their diet, the better. Are there any additional physical difficulties, such as scoliosis, a curvature of the spine, or difficulties related to vision and hearing? Difficult behaviour can often be triggered by certain words or actions. Parents will know what these are and can tell you what to avoid. It's useful to know how frequent hospital appointments are and to be aware of how this will affect attendance. How do parents feel PWS affects their son or daughter? Information in this presentation is a general overview, and the symptoms of PWS can vary considerably. Therefore, it's important to gain insight from parents as to how much they think their son or daughter is affected. PWS UK is the only charity within the UK supporting those affected by PWS. Please help us to continue with this by holding a Wear Orange Day fundraiser. Our easy-to-use pack provides all the tools you'll need to hold this easy and fun event, whilst also teaching some basic facts about healthy eating and Prader-Willi syndrome. The information can be downloaded directly from our website, or you can call our office on 01332 365 676 and speak to Karen. That brings us to the end of our presentation, and we hope you found it useful. We welcome your feedback if you feel it could be improved in any way. For more information, visit our website or contact us. We'll be pleased to help answer individual inquiries, and we also facilitate a teachers network consisting of an email circulation list for teachers of students of all ages to ask questions and to share experiences and good practice.